Hi, my name's Mark. I'm here. I've actually tracked down Dr. Lesley Short, who's an orthodontist from Queensland in Australia here, and it's taken me a while to track her down because she's so much in demand. But what I'd like to do is ask a couple of questions of you, Dr. Short, if that's okay, just to help clear some things up for those people who are not sure whether they should be going for an orthodontist or a dentist, for example.
Okay.
So if you don't mind me, I've just got a couple of notes here that I've made to ask some questions. And the first one is, why would someone need an orthodontist as opposed to a normal dentist, do you think?
Well, orthodontists actually just concentrate on straightening teeth, and that's the only thing that we do all day, every day, for years on end. So we kind of get quite good at using different mechanics. Sometimes it's braces, sometimes it's other appliances like nighttime headgears and things to wear. And we learn, you know, when to use them and what's the most effective way of using them to get a beautiful straight smile. That's basically what we're doing.
Okay.
And dentists, of course, do all kinds of things like extractions and fillings, and they do crowns and bridges and implants nowadays as well. But they're totally different fields, really. There's a tiny bit of overlap, but they're very different.
Okay, so really, if someone went to a dentist, that's very different to an orthodontist, you're saying?
Yes.
They don't do the same things?
No. Dentists mostly concentrate on doing regular dentistry, which is cleaning people's teeth and diagnosing fillings and restoring teeth, placing implants, bridges, very beautiful work, which can also help to enhance people's smiles. But our way of treating people is by using the teeth that they've got, not cutting into them or anything, but just moving them so that everything falls into place nicely.
So it's actually a specialised field then?
Very specialised,
Got
yes.
it, excellent. My next question is, what's the difference compared to, let's say, a dentist who's got 20 years experience compared to an orthodontist? Is it still that much difference? I mean, because he's got 20 years or even longer, some dental practitioners have?
Well, they have experience at doing dentistry, which is a different area. So most dentists don't have enough time. First of all, they haven't had the training. They haven't had the opportunity to really delve in depth into purely tooth movement that we do. And then they don't have the time in their practices because they're busy doing lots of other things as well.
Yeah, makes sense. Yeah. Got it. Okay, so basically what you're saying is if someone wants to hire the wrong person, it could end up being something quite expensive.
Well, it can be, and I have unfortunately seen disasters where people have had years of treatment that's been wrong and they have to start again.
Wow.
Yeah. That's
and
sad.
I guess you're in the firing line because they've now come to you and you've got to tell them that.
That's right.
Wow.
Yeah, that's very disappointing. And it's a shame to think that probably that dentist may not have even realised, but he didn't know.
Oh yeah, I see what you mean. Yeah, it makes sense. So I guess it's good to be informed.
Yes,
when you're looking around, what
vitally important. That's why we spend all those extra years at university, and that costs us all a lot of money to go back and do all that extra studying. It's because we want to be perfectionists in that area. We want to be experts.
Okay. So if I was a consumer, I was looking to have some work done, and I found out that I need an orthodontist to work on it. So I should probably be asking the dentist or the phone call that I'm making, are you licensed as a orthodontist? A
specialist orthodontist. Do they have? Are they registered with the Australian Dental Board as a specialist orthodontist?
Got it. Okay, makes perfect sense. All right. So another question I've got here is, what sort of responses do you get from some of your customers once they have had some good quality work done? Can you think of something in particular, say one particular customer who was just like really happy and? Yeah.
I often think of a little boy that said to his mum, "Mum, I'm almost handsome now," and that made me feel fantastic. But you know, quite often people have tears in their eyes. Today, I had a man who was, you know, well into his 40s, who's had crooked front teeth for most of his life, and he's not finished yet, but he's seen a huge improvement. And he said to me, "I'm almost getting tears in my eyes," because he's so happy with the way he feels about his teeth now.
Well,
it's
you
lovely.
feel different because you look different. You know, almost handsome as a little boy.
Yeah.
Wow.
Yeah, it's nice.
All right. There was another question that came in I thought was important too, and some of these are from just consumers that have asked these questions, is how long does it take for work to be completed from a typical patient, for example, or does it vary much?
Well, it varies a lot depending on what we're doing. The typical job for a teenager is roughly around about 2 years, and we try to keep most of our basic work to that sort of program, but then there are situations, especially for older people who probably don't want the full treatment, they just want their front teeth looking beautiful, where we can cut it down. It could be 6, 9, 12 months. So it depends on what we're doing and what our aims are. I guess if we're setting up a child for life, we want to make sure every tooth is perfect, and that's the job that we usually do starting at about 10, 11, 12, and it goes for 2 years.
Excellent. All right. Now, just to sort of finish up really quickly, can you give us, apart from asking the obvious question which we've already stated about, are you certified and licensed as an orthodontist, can you give us, say, 1 or 2 tips that we could use if I was shopping around to find an orthodontist? What should I be asking over the phone, for example?
Well, as we said before, it's very important to have a specialist orthodontist. The other thing is you want somebody who's been around for long enough to have learnt their trade well. So I'd say they should have had at least 5 to 10 years experience. And then also you want someone who's also staying up with what's going on, keeping up with all the modern new things that come out. So that means you want to know that they're either studying or they're teaching or they're somehow staying actively involved with their profession.
I guess I've seen myself, I've had some dental work done over the years, and I've noticed that things have changed quite a lot, just from general dentistry, so I can only imagine what it would be like in a specialised field.
Yeah. Okay,
well look, for somebody that might be watching this video right now, and I think maybe they'd like to give you a call, what's your phone number?
My number in Queensland's 07 5447 5040.
Wonderful. Well, look, thank you so much for having me over. I really appreciate you making the time for me, because I know it's been a bit tough, you've been busy. But thank you so much, and I look forward to talking again sometime.
Thank you, Mark. Thank you.
Pleasure.